Myself, Dr. Akhila, final year DNB resident from Narayana Health.
That's Team B. Team C.
I am Jumana. I am third year resident from Medical Trust Hospital.
I am Jewel, third year resident from Medical Trust Hospital.
Team D.
I am Faiza from Trustwell Hospital, Bangalore, second year PG resident, family medicine.
Myself, Dr. Arya, second year family medicine resident, Trustwell Hospital.
Team E.
I am Dr. Misna, DNB resident, final year family medicine from BPS Lakeshore Hospital.
I am Dr. Musliha, final year from BPS Lakeshore Hospital.
Hello. So, audience might be knowing. So before starting, audience might be knowing almost all answers. So please don't say it, okay? Otherwise, it will be very difficult to conduct. So there will be. I will be reading out. So we have planned 5 rounds. There will be clear instructions given before each round. So marking, the system will be different for each round. And quiz master's decision will be final. So we have selected team numbers. There are 5 rounds. Team A can select which round you want to go.
1 minute.
Round 4. So actually the image had no relation with this. Team E comfortable? Are you okay? Yeah. So let's see the instructions. This will start with Team A itself, don't worry. And this is a medical care round. You can select the questions. 30 questions for correct answer. 30 questions.
Sorry, 30 marks.
30 marks for correct answer. And if you answer after first clue, then 20 marks. If you answer after second clue, which will be the final, 10 marks. There will be no negative marking. And if the question is passed, then the next team will get 5 marks. No negative markings. 1 minute. You can select. So, Northwell Health has introduced the iNow system, an innovative tool aimed at improving early cancer detection by integrating advanced imaging techniques and data analytics. This system is particularly focused on identifying which type of cancer. So first clue is smoking is the strongest environmental risk factor for this particular cancer, and followed by a strong family history. So actually the second clue is the answer. If you can identify the condition, then no. Team B. Team C. No. Team C. Team C. Team C. Take your mic and answer.
Colon carcinoma.
No. We have already given 2 clues. Team D. Please answer using microphone. Team D. So you already know that it's a cancer and it's an abdominal cancer. So what all organs are left? Yeah. Team E.
Pancreatic.
Yes. Pancreatic cancer. So team D get 5 points. 5 marks. Team D. D, yes. Now team B can select the question. Question 5. So again, this is an instrument, Empatica Embrace 2, which can be used for monitoring a certain medical condition. This was invented in last year, 2024, and it's one of its kind. This has a set of 4 sensors, which works in sync to detect specific health condition and alert the caregivers, irrespective of their physical location. This is water resistant and has a good battery backup. This is the first FDA approved device for this kind of use. Name the medical condition. Please name the medical condition. You have 1 minute to answer. Again, this is the clue and this is the device. Sorry, louder, please.
Arrhythmias.
No. Team C. There is one more clue if you. No. Already.
Next clue.
Next clue. This condition was thought to be an act of evil forces, or it's an act of devil in earlier days. And in some part of the world, it's still considered as the. Others, please don't answer, okay? Yeah, last audience week. Question cannot be simpler.
Better.
Team D.
Clue is there? Next. Clue? Over.
Both the clues are given now.
Okay. Epilepsy.
Yes. Answer is seizures or epilepsy. Now team C. Team D 10 marks. Others are yet to start their scoreboards. Now team C.
3 was already
He
chosen.
was already chosen. 3 and 5 are already chosen. Yes. 2. Another device, the Dexcom stello sensor is newly approved device by FDA, which can be procured without a prescription. That's the highlight for this device in the United States. First of its kind. What is this device used for? Clue. Actually, this is the answer. This molecule causes the condition. This is not the disease actually. This is the molecule that is related with this condition.
Gout.
Gout. Gout. No. Team D.
Clue.
There is one more clue, yes. So, this condition is known as rich man's disease in many countries in Africa. You have to answer this.
Sickle cell.
Rich man's disease.
Team E.
Diabetes.
Yes. Team E gets 5 points, 5 marks. It's used for continuous glucose monitoring, and the molecule shown was glucose. Team D.
Team 1.
D.
1.
1. So the question is, globally 33 to 38 million people are affected by this condition. A diagnostic test for this condition based on p-tau 217 was developed through a collaboration between Roche and Eli Lilly and company. This test was received FDA breakthrough device designation. We are asking for the condition or the disease.
Clue.
Clue. The clue is Ronald Reagan, Kanagalada, Malayalam actress, Jean Connery, and many more were diagnosed with this medical condition.
One more clue.
One more clue. Now, it's obvious.
Alzheimer's disease.
Yes. The answer is Alzheimer's disease. Team D, that question. 10 marks. Team D gets 10 marks. Now, you don't have any option. Team E has to answer this question. Question is, family medicine practitioners play a crucial role in managing chronic conditions and improving patient outcomes. One of the latest advancements in healthcare is a device that provides durable and effective solution for patients with severe this medical condition. What is the name of this innovative device developed by Bivacor? So we play a crucial role in managing this condition, and Vivacor has developed a device. So this is also a recent development. That is why this question is included. And this device helps to
Clue.
So this is the device. Please have a close look. This is the device which will help the patients to have a better quality life and live longer. This is the first clue.
Second clue.
Second clue. Second clue. You have no idea about this. The structure. Okay, you want to go for the second clue? Yes? Sure. Okay. So now you have to answer this. On December 3rd, 1967, Dr. Christian Bernard in Cape Town transplanted this organ. For the first time. And this was a 53-year-old man suffering from this severe medical condition. This is a device that is a replacement to that organ.
Pass team A.
No. Team B. Left ventricular.
Left ventricular? No. Team C.
Team C. Take your mic, please. There are not many organs, no? There is no negative marking. At least say something.
Louder.
IABP.
No. Team D.
D.
Cochlear implant.
Okay, audience. Artificial heart. That's the right answer.
Audience guest.
So Vivacor developed this artificial heart, and this will help to, I don't know.
After the completion of first round, Team A without any points, Team B and Team C without any points, Team D with 20 points, and Team E with 5 points.
Now Team B. The question starts with Team B, and Team B can select the round. Round 1. So this is a clinical round. This start with Team B. You can choose your question. 10 marks for the right answer. Being a clinical round, you will get minus 5 marks if the answer is wrong, and 5 marks if the question is passed. Ready? All are clear with your instructions, I guess. Yes, Team B. Question number 3.
Okay. A 70-year-old woman comes to your OPD with a 5-year history of constipation. The patient who has had significant difficulties with ischemic heart disease is on atenolol and verapamil. On examination, the patient's BP is 180/95, heart rate is 72 beats per minute, and regular. Rest of the system is normal. The digital rectal examination reveals impacted stool. So what is the laxative group most closely associated with long-term side effects in the elderly? Which group of laxatives has the most common long-term side effects?
Team C. Louder, louder.
Louder, please.
Bowel stimulants.
Can you please be louder?
Bowel irritants or stimulants like bisacodyl.
Okay.
Yes.
Yes.
Yes. So stimulant laxatives, that is what we commonly see as Dulcolax. It has to be very cautiously prescribed, especially in the elderly.
Team C gets 5 marks.
Just for the notice of the participants, please use your mic like this, because there are people sitting in the behind row also, and they want to hear what you are saying. So please answer using your mics.
Now Team C get the chance to select the question.
A 45-year-old male comes to your OP with uncontrolled type 2 diabetes. He has a history of obesity, BMI is 34 kg per meter square, and hypertension. So he is on metformin 1000 milligrams BD, glimepiride 1 milligram OD, and lisinopril 20 milligram OD. His recent HbA1c is 9.2. So he complains of feeling fatigued and experiencing some weight gain over the past few months. So you discuss with him lifestyle modifications, and you decide to initiate him on tirzepatide to improve his glycemic control and to aid in his weight loss. So what is the most important personal or family history you should consider before you start a patient on tirzepatide?
Team D.
Clue is there?
There's no clue.
Team E.
Pancreatitis.
No. Team A. No. Team B. No. So what is the most important personal? No.
B and start C and start.
No, A answered, answer was wrong. Yeah. Yeah, B answered, yes. Show the answer. So it's a family history of medullary thyroid carcinoma. I'm sorry, I already answered it. So you need to assess the personal or family history of medullary thyroid carcinoma. You need to rule out other diseases, but this is most important. No. Specifically to tirzepatide.
Team D. 1, 3 are already selected.
Number 2.
47-year-old woman present to your OPD with complaints of hot flushes and tells you that her last period was 7 months back. So she is unsure if she needs contraception and asks your advice. Will you advise her to use contraception? If yes, for how long? So the two answers need to be correct to get the marks. She's 47-year-old and her last period was 7 months ago.
Team E. Team E.
Yes.
So for how long? You said she needs contraception. Okay, so for how long?
Till her menopause.
So her last period was 7 months ago. She's 47 and her last period was 7 months ago.
Correct.
5 more months.
No.
Team
Team
A.
A. Pass. Team B.
Yes.
Yes. Pass. C. D. Audience. Two, three, I heard 2 and 3. 2? Yes, 2 years is the answer. So less than 50 years, she needs contraception for 2 years. If it's more than 50, then for 1 year.
Now, question to Team E. You can choose from 4 and 5. 4 or 5.
5.
A 35-year-old male comes to your OP with fatigue, nausea, and right upper quadrant abdominal discomfort for the past 2 weeks. He has no recent history of travel, but he mentions having multiple partners for the last 6 months. No significant past medical history. On examination, his vitals are within normal limits, but he has mild scleral icterus and tender hepatomegaly. So you are suspecting hepatitis B. What are the 2 specific initial screening tests that you would do for an acute hepatitis B infection? The 2 answers need to be correct to fetch the full marks.
Team E. Team A.
Hepatitis B core antibody. LFT.
Hepatitis?
IgM core antibody.
No.
HBsAg.
If both answers are correct, then correct.
Team A. No. And DHB? HBsAg and? Can you specifically write the two investigations? Nana? Okay, yes. So it's HBsAg and anti-HBC, which is a core antibody. Sorry?
They also told the same.
You said core antibody?
Five marks.
Huh? Did you say core antibody? This round will get cancelled.
ഇല്ല ഈ ക്വസ്റ്റ്യൻ ഉണ്ടല്ലോ. രണ്ടുപേർക്കും 5 മാർക്സ്. രണ്ടുപേർക്കും 5 മാർക്സ്. ടീം ഡി ഇ ആൻഡ് ശരി. 10 മാർക്ക് വരേണ്ടതാണ്. That question is cancelled.
Yeah. Go to the next question.
This is for you.
No, so this is the same question.
4 അല്ലേ ചോദിച്ചായിരുന്നു? 4 ആയിരുന്നു ബാക്കിയുള്ളത്.
ഇതിന്റെ എക്സ്ട്രാ എടുക്കാം. So 72-year-old male with poorly controlled type 2 DM comes to your clinic with progressive tingling, burning pain and numbness in his feet, which has worsened over the past few months. His BMI is 34 kg per meter square. And he has a history of benign prostatic hyperplasia and hypertension. His medications include amlodipine for hypertension and metformin for diabetes. On physical examination, he shows reduced sensation and decreased reflexes in his feet with pedal edema. He also complains of nocturia and a weak urinary stream due to BPH, and his urine analysis is clear with no signs of infection. You decide to start him on a medication to manage his diabetic peripheral neuropathy. So which class of medications should you specifically avoid in this patient due to its potential side effects and contraindications? So he has poorly controlled diabetes and BPH and hypertension. And you need to treat him for his diabetic peripheral neuropathy.
Pregabalin.
No. Mention the class of medications, not
You
the
should
drug.
specify the class of medication.
Not the specific medicine.
Antiepileptic.
Antiepileptics is a big class.
Gabapentinoids.
Can you be specific, that specific class of medication?
GABA analogs.
No.
In A.
Yes.
That's the correct answer.
Yes, that's the correct answer. Now this question is to Team A. 27-year-old female presents your clinic with concerns about her irregular menstrual cycles and difficulty conceiving over the past year. Her periods come every 45 to 60 days and is often heavy. She also complains of increased hair growth on her face and abdomen, as well as recent weight gain. Medical history is unremarkable. Her BMI is 32 kg per meter square with hirsutism and mild acne. Her lab studies shows fasting blood sugar of 108, elevated fasting insulin, serum testosterone is elevated with 75, and the LH FSH ratio is 3:1. Her ultrasound shows bilateral ovaries with small peripheral follicles. What are the two most important initial management options for this patient to address both her metabolic and reproductive concerns?
For metabolic, first line is exercise, weight control, reproductive is OCP.
B.
Reproduction and metformin.
Yes. Team C can select the round.
Round 3.
Round 3. Round 3. So, you can choose your question. Each question has 2 sub-questions. 10 marks for the right answer. -5 marks for the wrong answer. If a team cannot answer any part, the question will be passed to the next. Either both parts or B part alone. 10 marks for the right answer after passing. Team C.
So 30-year-old woman presents with a white, malodorous, fishy vaginal discharge. There is no associated itch or dyspareunia. A diagnosis of bacterial vaginosis is suspected. Name the criteria used to diagnose bacterial vaginosis. What is the name of the criteria? Please hold the mic.
Naegler's criteria.
Sorry?
Naegler's criteria.
No.
Team D. There are 2 questions. Name the criteria and what is the drug. Team E.
AMSLS criteria.
Yes.
Drug of choice is metronidazole.
Yes.
Now question D. Question goes to Team D.
Number 1.
A 68-year-old woman presents with a 2-month history of electric shock-like pains on the right side of her face. She describes having around 10 to 20 episodes daily, each lasting for 30 to 60 seconds. A recent dental checkup was normal. Neurological examination is also unremarkable. What is the diagnosis?
Trigeminal neuralgia.
Yes.
Carbamazepine.
Yes, right.
Team E. Louder.
3.
I think 3 is already...
1 and 3 are already.
1 and 3 is over.
2.
A 40-year-old woman complains of a permanent funny bone sensation in her right elbow. This is accompanied by tingling in little and ring finger. Her symptoms are worse when the elbow is bent for prolonged periods. What is the most likely diagnosis?
Tennis elbow, ulnar nerve.
What's the first diagnosis?
Saturday.
Team A.
Team B. Team A. What is the diagnosis?
No. Most likely diagnosis. Team B. No. Team C.
Team D. Audience.
No. Should be answer.
Cubital tunnel syndrome and answer. The second answer is ulnar nerve. Team A. Team A. 4 or 5?
4.
A mother comes with her 14-year-old son and 17-year-old daughter to your OP for HPV vaccination. So the son has already received 1 dose of HPV vaccine 1 year back. What is the remaining schedule of HPV vaccine for the son? Pass.
Team B.
Yes. So what is the schedule of HPV vaccine? So the son needs 1 more dose. The second question is, what is the schedule of HPV vaccine for the daughter? Yes, right. First, yeah.
Second. Last question here or last?
Team B. A 47-year-old man who is known to have dermatomyositis secondary to small cell lung cancer is noted to have roughened red papules over the extensor surfaces of the fingers. So what are these lesions called? Yes. List 2 other skin features of dermatomyositis. Any 2 features. What's the first one? Okay. Yes.
Now, 2 more rounds. We will. Okay. The next question goes to Team D. Team D can select the round. Which round?
Round 2.
Round 2. So this is a literature round. And the question starts with Team D. You can choose your question number. Each correct answer will fetch you 10 marks. There is no negative marking. If a team cannot answer, the question will be passed to the next team. The next team also get 10 marks. Direct or indirect, you will get 10 marks. There is no negative markings.
We'll just announce the scores till now. Team A -15, Team B 25, Team C 5, Team D 40, Team E -5. We'll move to round 4.
Round 4. Round 4, and the D can select the question. 1 to 5.
Question number 2.
Question number 2.
In the NBC series Brilliant Minds, Dr. Oliver Wolf suffers from which unique neurological condition that influences his interactions with patients? If you answer, you get 10, no negative markings.
Team E.
Team T is passing to Team E.
Team E. Team A. No negative marking.
No.
Team B.
No.
Team C.
No.
Audience.
Anyone, audience?
Audience.
Yes.
Yes, right answer. Dr. Prashant gets chocolates. Now Team E can select your question. There is no negative marking. Three.
So this movie humorously and sensitively highlights how the protagonist, who is a male gynecology student, navigates the challenges and biases of a traditionally female-dominated field, fostering discussions on gender equality in medicine. What is the name of this movie? Pass. Team A.
This is going to hurt.
Hurt whom?
Team B. Team C. Team D. Audience.
Yes, Dr. G.
Dr. G. Yes. Next question goes to Team A. Team A.
Choose your question. Sorry? Question number 1, no. Siren, question number 1. So Emerson Mother, who was the Crayola's head crayon maker at the time of his retirement, he revealed that he had a disease. And the entire board was dumbstruck when they heard that he has that specific disease. So what was the condition he had hidden all through his career? Yes.
Team B.
2, it's done. 2 is, it's over. I think 3 and 5 is remaining.
3 and 5. 3.
No, 3 is done. So maybe 4 and 5 is remaining. This is over. 3 is over.
ഏതാണ് സെലക്ട് ആവാത്ത ക്വസ്റ്റ്യൻ?
Only 4 is remaining?
അല്ല ഇനിയുണ്ട്.
Okay. So what disease is central to Dr. Paul Farmer's work in Haiti, as highlighted in his book, Mountains Beyond Mountains by Tracy Kidder? What's the disease that is being talked about in that book? No negative marking, so you may as well guess any disease.
Team C.
No. Team C.
Sick diseases. Sick-borne fears.
Louder, louder.
Sick-borne fears.
No. Team D.
Sickle cell anemia.
No. Team E.
Team E. Team A.
No. Tuberculosis. Sorry. No, audience has some more questions in this, I think.
കഴിഞ്ഞല്ലേ ഏത് ക്വസ്റ്റനായിരുന്നു ബാക്കി
Wait.
5 ക്വസ്റ്റനായില്ലല്ലോ ഏത് ക്വസ്റ്റനായിരുന്നു ചോദിക്കാത്തുള്ള എല്ലാം കഴിഞ്ഞല്ലോ 5 ക്വസ്റ്റനല്ലോ ആ ഇത് ചോദിച്ചില്ല ടീം സി അല്ലേ സി ടീം സി
ഓണത്തിനിടയിൽ ഒരു പുട്ട് കച്ചവടം. There is a working tea going on this right hand side.
Team C. Team C.
C.
Actually, this is not the end of the quiz. There is one more round. There's just...
Okay, so this question is to Team C. In the documentary The Human Trial of 2022, clinical trial focuses on a radical stem cell therapy for a chronic condition that requires lifelong management. What is the disease being targeted in this documentary? It was released in 2022.
Plastic anemia. Plastic anemia.
Can you?
Plastic anemia.
No. Team D.
Thalasseria.
No. Team E.
Leukemia.
No. Team A.
Severe combined infections.
Sorry?
Severe combined immunodeficiency.
No. Team B. No. Audience? Yes. Type 1 diabetes.
Yes, for. You want audience questions?
Some questions to the audience.
And now the audience here is the genuine quiz interested people. All this has moved for the tea. I think this is the right time to ask questions to the audience.
2 questions for the audience.
Which 2024 medical drama series follows Dr. Max, a new doctor aboard a luxury cruise ship where he navigates medical emergencies and provides care in remote locations far from traditional healthcare facilities?
Audience.
It's the latest medical drama series.
This is for audience. Any takers?
Hospital ship? No.
New Amsterdam.
No.
No. ODC?
Yes.
Right answer, your name please.
Inam.
Dr. Inam.
Next question. One more question to the audience.
Which book explores the groundbreaking lives of Elizabeth and Emily Blackwell, the first women to receive medical degrees in the US, and their struggle to overcome societal barriers in the male-dominated medical field?
After the completion of 4 rounds, the scores are Team A with -5 points, Team B with 25 points, Team C with 5 points, Team D with 40 points, and Team E with -5 points. We are in the final round, which is an image-based round.
Audience?
And the
Any takers? No one. Any?
The doctor is Blackwell. Okay.
So this is the image-based round, and this is the simplest round. So this starts from Team E, and you can choose your question. 10 marks for the correct answer, 5 marks if you pass the answer, if you pass the question and answer, and negative 10 marks for a wrong answer. You can gain as well as lose. Ready? 10 marks minus 10 marks.
5 marks if it's a pass.
Team E. This is the last round. And 1. So, question is, identify this medical condition. Same condition only, same patient, different images.
Ankylosing spondylitis.
Yes.
Yes. Team E gets 10 points.
Team A.
Team A. 2, 3, 4, 5. 2. So, this is an X-ray of 32-year-old male, history of trauma while playing cricket. So, you have to identify, obviously it's a trauma, so you have to identify what it is. So, this is another view. It's obvious.
Team B.
Team B. Team B. You have to name that fracture. The fracture is very obvious. You have to name the fracture. Team C. 0, 0, 0. Team C. Team D. Team E. Audience.
Yes.
Yes.
Fresh hope.
Now, question goes to team B. Last round, third question. Team B, you can select the question. 1 and 2.
1, 2 over 3.
3. Very simple, very straightforward. I would say the simplest. What is the condition? The 4-year-old male child presented with complaints of nasal congestion, disturbed sleep. Even without image, it's obvious. Adenoid hypertrophy. Correct answer. Team B gets 10 points. Now question goes to team C. Second last question. 4 and 5 are remaining.
4.
4. So this is a 11-year-old male child who was brought to emergency with complaints of abdominal discomfort. This is one X-ray we have. One more X-ray. If you need clue, we can give. You won't lose points for that. Now you have to answer. It's very obvious, very simple. Foreign body where? If you say foreign body, you won't get mark. Foreign body where?
All in the same.
This is the first image, this is the second image. You want to answer or not? Time is up. Team D. You want to answer or not? You want to pause? Team E. Team E.
Foreign body stomach.
Yes, that's the right answer. It is a battery. So, with this question, our quiz competition comes to an end. And it goes to team D. Again, I will say this is the simplest answer. 14-year-old boy fall onto elbow. Now complains of pain and reduced movement. We have two views. Elbow pain, history of fall. This is the first X-ray. This is the second X-ray. Team D. 14-year-old boy, history of fall, complaints of pain and reduced movement. Team D. The first image. Time is up. Team E. Team A. Wrong answer. Team B. -10. Team B. Team C. Team C. No. Audience. Who said normal? Now teams can't answer. Who said normal?
Now it's for the audience.
It's for the audience. Who said? Who said normal? Who wants chocolate? Ashwati, you told normal, right?
Okay,
Dr.
so
Ashwati gets
the chocolate.
chocolate. This is a normal study. Okay. So we have come to the end. Now Dr. Nadeem will announce the positions.
Thank you, Dr. Sirin. Thank you, Dr. Zerin, for mastering the quiz competition. Now we have the final result of the quiz competition. Out of the 26 teams competed for the quiz competition, Dr. Jay Ganesh and Dr. Aravind Krishna from KIMS Trivandrum became the 5th team in quiz competition. Give them a big hand. Dr. Joel and Dr. Jumana from Medical Trust being the 4th team. Congrats, Dr. Joel and Dr. Jumana. And the 3rd place winners is Dr. Misna and Dr. Musliha from Lakeshore Hospital. They will get a cash prize of 3,000 rupees along with the award which will be presented during the valedictory function tomorrow. And the 2nd place goes to Dr. Akila and Dr. Aisha Tasneem from Narayana Hridayalaya, Bengaluru. And the winners of this quiz competition is Dr. Faiza and Dr. Aya from Treswell Hospital, Bengaluru. Give them a big hand. Please stand up. Dr. Faiza and Dr. Aya from Treswell Hospital, Bengaluru. Thank you, all the participants, and special congrats to the winners. Now it's time for winding up the proceedings for this day. Mansoor.
Just one small announcement. The answers for the prelims will be published on the website.
Okay, we have poster presentation which was done in the morning time. If you want to see it during the tea time, you can just go through it. Now our vehicle which is traveling to beach is ready. If anyone wants to join, you can come to the courtyard of the hotel. And we'll be back by 6:15. At 6:30, a general body meeting is convened at the Lawns open air auditorium which is set outside. And don't miss everyone, please join us for the banquet which is arranged at 7 o'clock. We'll be having a gala with music and there will be a lot of fun which is arranged by our cultural committee leader Dr. Lamiza. Lamiza and team will be performing. We have professional musicians and we invite each one of you to join us for the cultural events which is planned for next today. Night. And I request everyone to be here by 9 o'clock itself. Tomorrow by 8:50 our workshops will be beginning. Our first session will be over at 9:30 and we will be having the official inauguration of this conference by our beloved Speaker of Kerala Legislative Assembly, Shri A.N. Samsir. And I request each one of you to be here for the inauguration and make that event also a colorful one. Wish you all a good conference ahead. Thank you, one and all. എല്ലാവരും ബീച്ചിൽ പോകുന്ന ആളുകളുടെ പ്രത്യേക ശ്രദ്ധയ്ക്ക് തിരിച്ച് 6 മണിക്കൊക്കെ ബസ്സിലേക്ക് കയറാൻ പാകത്തിന് വേണം പോകാൻ. ബീച്ചിൽ കടലിൽ ഇറങ്ങാൻ താല്പര്യപ്പെടുന്ന ആളുകൾക്ക് അതിനുള്ള ട്രൗസേഴ്സ് വേസ്റ്റ് എടുത്തു വേണ്ടി പോവാം. താങ്ക് യു.